Come in.
Hello, my name is Melissa and I'll be your nurse today. I'm just going to perform hand hygiene and give us some privacy. And can you state your name and date of birth for me?
Sean Benjamin, 10-10-10.
Perfect. All right, so the doctor has ordered for me to do a head-to-toe assessment on you. I'm going to have to touch you a little bit. Is that okay?
That's fine.
All right, cool. So I'm going to ask you a few questions to start off. Can you state your name one more time?
Sean Benjamin,
Okay, and do you know where you are
United States of America.
currently right now?
Georgia, the doctor.
Okay, and how did you get here?
I drove.
Okay, and who's the current president?
Donald Trump.
All right, and have you had any major head trauma or perhaps brain surgery ever?
Not today. Or ever. Sorry.
Okay. So if you did have head trauma, we would assess you on the Glasgow-Coma scale, which is a 15-point metric, and it would measure his speech, his motor skills, which we'll get to later, and his visual acuity. So you're 15 points, you're good to go. Also, you're making eye contact with me. Your facial expressions are pretty happy. Glad you're happy to be here. And yeah, you're verbal, you're listening, your response time. Your skin looks good, it looks symmetrical everywhere.
Oh.
Like I said, I'm gonna have to touch you. Your skin's warm to the touch. You have good hygiene, which is good. You, yeah, so we're gonna start with your head, okay? So your head is normocephalic. It's average size for your body. And no bumps or lesions or scars. Do you have any tenderness?
No.
All right. And moving on to your ears. Your ears are average size for your face.
Thank you.
The top is midline with the outer canthus of your eye. So that's good. Do you have any drainage or hearing issues?
No.
Okay. If my patient did have any hearing issues, we would do the whisper test. I would cover up one ear, whisper 3 words. You would repeat them back on the same side. So you're good. Also, let me do your eyes. So we're looking for perla, which is your pupils are equally round, reactive to light, and accommodating. So your pupils are about 4 millimeters, and they're equally round. So I'm going to shine this light. Just look this way. Look at the wall. All right. It directly constricts, and this one consensually restricts. Keep looking that way. All right, and that one directly constricts, and that one consensually restricts. So now I need you to just follow my pin light. And to the side. Side. All right, good. So your pupils are equally round, reactive to light, and accommodating. Do you have any vision problems or wear eyeglasses?
No.
Okay. Moving on to your nose. Your nose is average size for your face, midline. Do you have a history of nosebleeds or do you have difficulty breathing?
No.
Okay. Can you just close one nostril and breathe? To the other. All right, good. No difficulty?
No.
All right. Moving on to your mouth. I'm just going to say ah.
Ah.
All right, your oral mucosa is pink, shiny, and moist. Your teeth are shiny and looks like you have good hygiene. Do you have any cavities or any lesions? No, you don't have any lesions. I just looked. Okay. Do you have any difficulty breathing?
No.
All right. Let us swallow for me. All right, good. And your trachea is midline. And while I'm here, I'm just going to look for JVD. Can you turn your head to the left, to the right? All right, to the other side. All right, no JVD present. So we're going to move on to the musculoskeletal system now. So what I want you to do is just walk this way. And I'm going to be watching how you walk. All right, and then back to the couch. Okay, everything looks good. Before you sit down, we're going to assess your balance. So there's 2 tests that we can do, the tandem, which is heel to toe, or the Romberg test, which I'm going to do on you today. So I just need you to close your eyes. I'm going to watch you for 20 seconds. All right, no unusual swaying or anything, so that's all good. You're free to sit down. And do you have any major surgeries that I should be aware of or any joint pain?
No.
Okay. So I'm going to use 2 of your upper extremity joints and 2 of your lower. I'm going to do your elbow. So I'm going to hold the joint in my hand, and I want you to touch your arms to your shoulder in a flex motion, okay? And then back down, extend. No popping or crepitus. All right, now just resist me. All right, and resist. Okay, strength is good. I do the same thing for the other side. Before we move, I'm going to do your wrist, actually. So this way, what I want you to do is go down, like this, and then hyperextend. Good. All right, no popping or crepitus. Now resist me, go down. Now go up. All right, your strength is good. Your elbow, so same thing, and down. No popping or crepitus. It's good. And resist me. All right, and your strength is also good. Same thing with the wrist. I'm gonna hold your joint, go down, extend. All right, no popping or crepitus. Now resist. And resist. All right, good. Your strength is good. I popped and crepitus. Okay. Now we're gonna do your knee. So I need you to flex backwards and then straight out. No popping or crepitus this time. Wow. Okay, good. Now resist me. You resist. Very good. So now I'm gonna hold your ankle. I want you to plantar flexion down, dorsiflex up. And up. No popping or crepitus. Now resist me. Resist. All right, your strength is good. Last side. Okay, and go back. Flex backwards and extend out. No popping or crepitus. I just need you to resist me. So go backwards. And forward. All right, strength is good. Last time. Ankle, go down, then up. All right, no popping or crepitus. Now resist. All right, everything looks good. So now we're gonna move on to your cardiovascular and your respiratory. So, do you have a history of coughing?
No.
Came in for a cough at all?
Not today.
Okay, so no mucus or sputum?
No.
Okay, if you did have coughing or mucus that you needed to break up, I'll just tell you about a couple of things. So we have the incentive spirometer. That's a device that you're gonna form a tight seal around the mouth, inhale slowly, hold your breath for 3 to 5 seconds, and then exhale, okay? Mm-hmm. And that's gonna expand those lungs. So I want you to do that like 10 times an hour, maybe 2 to 3 times during a commercial break. You understand what I just said?
Yes.
So what is an incentive spirometer and how do you use it?
I'm gonna wrap my lips tightly around it. And I'm gonna inhale and hold.
Yes.
10 times an hour for 3 to 5 seconds. If not, I could do it in my commercial breaks.
There you go. Great job. So the other thing, if you were bedbound, you just had surgery or something, you would do the turn and cough method. So you'd be in bed, you would take a deep breath in, you would exhale slowly, you'd brace the pillow, and you would turn and cough. That way. There you go. The same thing for the other side.
So if I'm holding on this side, I look that way and breathe?
Yeah, you would turn that way and cough. You want to brace the side that you're about to. Yes, and that helps break up some of those mucus secretions.
Okay.
All right.
Good.
So now I'm just going to listen to your lung sounds. You said you have no difficulty breathing, correct?
Not today.
All right. So this is my diaphragm side. It would be under his clothing, but for the video, we're just going to do it over his clothing. All right, so when this touches you, I want you to take a deep breath in and out. Left upper lobe. Right upper lobe. I'm sorry, this is the right, that's the left. Left lower lobe. Right middle lobe. Just cross your arm. Right lower lobe on the lateral side. All right, and the left lateral side. Now I'm going to listen to the posterior side of the lungs, sit up straight, and when you feel this, just take a deep breath in and out again. Left upper lobe. Right upper lobe. Right lower lobe. And left lower lobe. All right, everything sounded normal. I didn't hear any adventitious noises. And during your vital signs, I believe I got your respirations at 14 breaths per minute. And it was euphemia unlabored. So now we're going to move on to the cardiac assessment. So do you have a history of heart disease or any pain in your chest or tingling of the arms?
No.
Okay. So I'm just going to assess you for some edema. Starting up here, working my way up. No pitting or edema. All right, no pitting or edema. And I'm going to just pinch your chest. You look hydrated. You look well fed. Good.
Very well fed.
Okay, now I'm going to do your capillary refill. All right, comes back within 3 seconds, so your circulation in your body seems to be okay. And your nails are cut short, clean, hygienic. So it looks like you take care of yourself. No rigids or anything like that. All right, good. Now I'm just going to assess your pulse one more time. I'm feeling for the strength of his radial pulses. And this is 2+ bilaterally. I'm going to do the inside of your ankle, which is the posterior tibial. 2+ bilaterally. And the top of your foot, dorsalis pedis. 2+ bilaterally. And you have other sites too, so you have your carotid right here, you have your axillary under your armpit, you have your brachial right here, and your popliteal behind the knee, okay? So now I'm just going to listen to that heart. Once again, this is on direct skin, using the diaphragm side. I'm going to start on the right side of your chest. At the second intercostal space, it's the aortic valve. Then I'm moving over to the left side of the chest at the second intercostal space at the pulmonic valve. Third intercostal space at Erb's point. Fourth intercostal space at the tricuspid valve. And then the fifth intercostal space, just mid-clavicular, is going to be his mitral valve, or his apical pulse, where I would listen for a full minute. And S1 and S2 are all present. I feel like I talk louder when these are in my ear. And I would use the bell side of my stethoscope if I heard any murmurs or S3, S4 noises. So now, just need you to lay down.
Doggy.
And if you don't mind, if you'll just expose your belly. Look at that 6-pack.
Oh, yeah.
So, do you have any discomfort after you eat or anything like that?
No.
Okay, and when was your last bowel movement?
Lunch.
And was anything abnormal about it?
It was great. It was normal and everything.
Okay, good. Always good to hear. Okay, so just upon looking at you, I don't see any hernias, any lesions, no rigidity. Looks normal, round, flat and round. Okay, now I'm just going to take a listen to your bowel sound, starting in the lower right quadrant, using the bell side. I hear high clicking, which is a good sign, normoactive. And I'm moving up to the right upper quadrant. Normoactive. Left upper quadrant. Normoactive.
Okay.
Then the lower left quadrant. Normoactive. And I'm going to use the bell side of my stethoscope just between under his xiphoid process and in between his umbilicus. I'm listening for a AAA, which is an abdominal aortic aneurysm, or Bruit's. Whooshing. I don't hear any of that. No vascular noises. All right, good. I have to feel you now.
Palpate me.
Gotta palpate you. So, tell me if you feel any tenderness or anything. It's harder than normal.
Some tensing.
Just relax. I need to get in there. Alright, I don't feel any abnormalities. Everything feels normal. We'll go a little deeper. In each quadrant, working my way clockwise, stirring you up.
Thanks.
You always do this last because you stimulate bowel movements and peristalsis, which means your bowel sounds would be louder than they typically would be if I did this first. Alright, and with your urinary system, are you experiencing any burning sensations, foul odors, or anything unusual with your stream?
No.
Okay, that's great.
It is.
Okay, well I think that about covers everything. I didn't see any clubbing of the fingers. Your circulation looks good. And before I go, I'm just going to explain 3 risk factors that we use on the Braden scale.
Okay.
So that's a scale we use to see how potentially you might get a pressure wound. So if you were bedbound, immobile, you're active, so that wouldn't happen to you. You have good nutrition. Poor nutrition is a factor. Immobility is a factor. And so is inactivity and dehydration. So those are just some things. Okay?
Okay.
You have any questions for me?
Not at all.
You had a good time?
I did.
Perfect. All right, I'll send the doctor in, okay?
Thank you.